I'm here as a member and a board member of the U.S.-Mexico Border Philanthropy Partnership. So welcome to all on behalf of the U.S.-Mexico Border Philanthropy Partnership. Our session this evening is entitled Philanthropy's Changing Landscape. What does the future hold? A great question. We have a great panel of community foundation leaders from the Borderlands, as well as a representative from a leading national foundation joining us to talk about the COVID-19 pandemic, its impact on communities, on families, and on the nonprofit sector. But before we start, let me share a little bit about the U.S.-Mexican Border Philanthropy Partnership, which I will refer to as BPP. For the last 12 years, BPP has been supporting a network of organizations that build prosperity through leadership, collaboration, and philanthropy in the U.S. border, Mexico. It is the only binational organization along and across the 2,000-mile border that unites a vibrant network of national, regional, and local leaders and organizations who are making a difference on both sides of the U.S.-Mexico border. As many of us know, the story of the border is an unending book with many authors who for generations have written their stories with hardship and sacrifice, but who have transcended that adversity with unyielding optimism. And it is that optimism that inspires BPP's vision for a thriving border region composed of vibrant and successful families and communities whose children can expect a brighter tomorrow. BPP's growing dynamic network includes leaders and organizations from academia, from business and corporate entities, from government, from philanthropy, and from the nonprofit sector from across the U.S. 10 border state region, as well as from distinct areas around the U.S. and Mexico. We share a common vision and commitment for a thriving border region. But today is about the pandemic, about a conversation about the pandemic. But since the beginning of the COVID-19 health pandemic, BPP has contributed significantly to the development and capacity of the philanthropic and nonprofit sector. So let me brag a little bit on that, on the fact that over 2,500 staff leaders in the 10 border states were served through education and training opportunities provided by BPP. About the fact that BPP was asked to provide a briefing to U.S. government federal emergency management officials on the COVID-19 relief issues in the region. That BPP provides fiscal agency support to nonprofit organizations to make things happen along the border. That BPP secured almost $400,000 of in-kind medical relief supplies to support mobile COVID-19 clinics across 5 key cities in Baja California, supporting more than 16,000 people along that region. That BPP provided organizational coaching to nonprofit organizations to help them navigate these difficult times we're all facing, and that we continue to inform the general public through our bi-monthly newsletter in English with the Border Bus and in Spanish to Eco Frontera about how our member partners are leading during this time. We're indebted to the wonderful support of our member network, our donors, partners, and the stakeholder allies that we have, many of whom are here with us tonight. Because of their support, we're able to contribute this important work between our two countries. So gracias to all of them. They're here today with us, but I also want to recognize that some of our board members are here, as is our executive director, Andy Carey, and his team, and many others who have supported us throughout the years. But now it's time for our panel discussion to begin. So to start this conversation, I want to introduce our moderator, Lisa Urias, who is an Arizona native with experience in international relations. Before founding Urias Communications, where she is the president and CEO, she spent 12 years providing international marketing services to the Undersecretary of Energy of Mexico, Alberto Escofet. She also served as the Director of International Marketing to 70 countries for Salt River Project, a major utility company here in Arizona. In 2013, the Arizona Republic, our newspaper, listed her as a person to watch, and we still are. She's earned numerous awards and recognition throughout her career. She's a leader in the state, and I'm happy to share that she serves on the Arizona Community Foundation as one of our board members. Please welcome Lisa Urias.
Muchísimas gracias, Elisa. What a beautiful introduction. Thank you. Buenas tardes y gracias a todos por estar aquí con nosotros. Es un placer para mí servir como moderadora de este distinguido panel. It's a real pleasure for me to be here with you tonight and to serve in this capacity. So thank you for joining us. We have a really wonderful group of people here with you today. I am going to just briefly touch on some of the work of the Community Foundation in a big picture, and then we're going to go to introducing each of our panelists and having questions. After we are through with the questions that I have, we welcome your questions in the chat. So we hope that you will put those in the chat so that we can make sure to incorporate any questions that you have. So this is Community Foundation Week, and COVID-19 relief funds across the Borderlands has grown to $120,700,000. Generosity really knows no borders, and that is really true in the US-Mexico border region. Community, public, and private foundations from San Diego to San Antonio on the US side of the border, and from Tijuana to Matamoros on the Mexico side of the border have responded to the health pandemic with incredible speed and generosity. So the community foundations across the US have invested $1.1 billion for COVID-19 relief. And here in the Borderlands, as I just mentioned, that number is over US 120 million. The three community foundation representatives on this panel raised 10% of the national total. San Diego was 51 million, Arizona 46 million, and San Antonio 13 to 15 million. And as Elisa mentioned, those funds have been distributed to help nonprofits, deliver food to the hungry, provide economic relief to the unemployed, medical equipment to first responders, daycare for essential workers, grants to small businesses in jeopardy of closure, and many, many other things, needs identified by organization along and across the region. So it's my pleasure now to introduce you to the panel that will be speaking to you now. So if we could just get a picture of the panelists up, please. Right now, I'm just seeing Elisa. If we can get a gallery view, I guess I can control that. I thought someone else was controlling, so forgive me. So now I'm going to introduce each of our panelists. So just wave your hand. I know they can see your names, but Patricia Mejia is the Vice President of Community Engagement and Impact at the San Antonio Area Foundation, where she's focused on targeted investments to create more equitable communities. With $1 billion in assets, the foundation works in collaboration with partner organizations across sectors to address the area's greatest needs, both at the community level and individual level. Patricia's 20 plus years and as an executive in both the nonprofit and philanthropic sectors allows her to finely tune community voice, to lead her team to implement trust-based philanthropic practices and authentic community engagement. Please welcome Patricia. Next up is Mark Stuart. Mark is President and CEO of the San Diego Foundation, where he's responsible for developing and managing relationships with a wide range of stakeholders and helping donors realize their hopes, dreams, and aspirations. Prior to joining the foundation, Mark managed a staff of 64 and a budget of 14 million at the San Diego Zoo Global, including development, membership, and government and community relations. Under his leadership, they raised $530 million in its first ever comprehensive fundraising campaign. He also served as the founding president of the foundation of San Diego Zoo Global. He worked with the board of directors to fuel the vision for highly impactful programs like the San Diego Zoo Kids TV channel, Wild Heroes for military veterans, and teacher workshops in conservation science to increase science literacy across the US. He's the founder of an industry-wide collaborative to increase capacity, data sharing, and best practices for accredited zoos and aquariums. And he also served as Associate Dean of Development and Alumni Relations for the University of Pennsylvania School of Veterinary Medicine. Welcome, Mark. Next up, we have Laura Speer. Laura is the Director of Strategy at the Annie E. Casey Foundation, where she works with the senior leadership team to develop and implement the foundation's vision of a brighter future for all young people in the United States. Prior to her current position, Laura had primary responsibility for the National Kids Count Project and managed a portfolio focused on national policy research and advocacy with a special emphasis on racial equity policy and policies impacting immigrant families. Having spent a number of years doing state and local level child advocacy work, Laura served as a key resource for state advocates in the US, as well as a number of child advocates in Latin America interested in data-based advocacy. Laura is a member of the board of directors of the US-Mexico Border Philanthropy Partnership, grant makers concerned with immigrants and refugees, and WYPR Public Radio in Baltimore. Welcome, Laura.
Thank you. Hi, everybody.
And finally, Steve Seleznow. Steve is President and Chief Executive Officer of the Arizona Community Foundation, a statewide philanthropy whose mission is to lead, serve, and collaborate to mobilize enduring philanthropy for a better Arizona. Founded in 1978 and headquartered in Phoenix, ACF has more than 1,800 funds, a network of 6 affiliated foundations throughout the state, more than $1 billion in charitable assets under management, and is Arizona's largest statewide grant maker, largest private provider of scholarships to students, and among the nation's largest 30 community foundations. Today, ACF has made nearly $1 billion in charitable grants, scholarships, and impact loans throughout Arizona, across the United States, and internationally. Prior to leading the Community Foundation, Steve served as program director and deputy director for the Bill and Melinda Gates Foundation's U.S. Program in Education, managing the implementation of a $2.5 billion investment portfolio throughout the country. He was also a teacher, principal administrator, and deputy and acting superintendent of schools in the Washington, D.C. region. Welcome, Steve.
Thank you.
All right, so as you can see, we have an incredible panel today, and we're very excited that they're all here with us. We are going to start our conversation just by asking some questions around what's going on now that we have been through this situation with COVID and this pandemic. So I just throwing out the first question to each panelist, that what is the status of the pandemic in the areas where you're living, and how is the foundation responding? As we know, it's a national crisis. We've got cases rising again, but tell us a little bit about how your area is responding. We can get started there with Patricia.
Thank you for that question, and thank you for having me. You know, and in most situations, I always want to take the opportunity to brag about this city that I love so much. And I will continue to do that even in our COVID response. While this is unprecedented times, and we as a community have had about 70,000 people who have been infected, our city leadership has done an incredible job of truly trying to get the right public health message out there, and so taken all the right precautions and really helped us. Unfortunately, we're not different than what we hear across the country. Just in the past month, our positivity rate has actually jumped. It's doubled. We're at about 9% right now. In regards to unemployment, we are surpassing national average. A lot of that, if you look at the industry, which I'm sure is similar to many of the cities that our partners, our panelists are from, heavily rely on tourism. And so we are struggling in that sense. But the thing that I'm most proud of is, while all of that is true, that there are definitely families hurting, the pandemic, we're not in a bubble, we are definitely feeling the effects. I'm most proud, as I'm sure many of my colleagues, is the response. I loved what you said earlier, that generosity does not have borders. And in this case, we've seen so many incredible things happen with our friends and our partners here in San Antonio. Right at the beginning in March, quickly we followed what some of our other partners and community foundations, particularly what Seattle had set up, just because they were experiencing a little bit faster than we had. And we did set up a COVID response fund. We seeded it with a couple of million. And in a very short time, that went over 6 million. And a lot of that was because of the strong partnerships that we had in existence before. At the peak of that grant time, we were looking at somewhere between 60 and 90 applications a week. And we were getting out dollars within 10 to 20 days. Everything, as you mentioned, from looking for a vaccine, for COVID as to food security. So the response has been incredible, and that's really only a part of the story. Our donor advised funds have also done some incredible things, and I'm looking forward to the conversation where I can really highlight not just what philanthropy has done, but what the real heroes have done, which is those who are on the front lines of our nonprofits who truly pivoted and used those dollars that we were able to raise to really make a true impact in our community and are carrying us forward.
Yeah, that's a really important point, Patricia. I'm looking forward to hearing a little bit more about that as well. Mark, do you want to touch on this? What's happening there in San Diego?
Yeah, so as Patricia mentioned, San Diego is a metropolitan area that really depends upon group travel. I mean, 72 degrees, sunny and onshore breeze, that's what life is like here on a regular basis. And so as the pandemic descended upon San Diego in mid-March, everything shut down. Within 4 days, thanks to leadership with our county supervisors, San Diego Gas and Electric, and the foundation, we set up our COVID-19 Community Response Fund. At the time, we thought we would focus on financial needs, rent assistance, food security, and other basic living expenses. And the outpouring of support was just remarkable. So in those 8 months, we've now have granted out about $53 million. Just about every single dollar is out of the house. We're desperate for more. And we've now started to pivot more toward learning loss and the digital divide, as we're just hearing that still to this day, we've got something like 18,000 high school seniors in San Diego County who aren't connected to the internet and don't have the means to be able to do so. And so their learning loss is really quite profound. One of the things that we also did that I'm so proud of is we created a very community-based grant making and grant approval process, bringing leaders from all over the community. And what it helped us do is to realize that there are people in San Diego who are parts of cultural, ethnic, and racial populations who would never go to the Salvation Army, never go to Feeding San Diego, and that we made sure we got the money to organizations that address their needs. And so we have built a database now of some incredible nonprofits that we had never worked with before. And so one of the benefits of the COVID-19 challenge, if there are any, is these deep relationships that we now have that make us a much better grant maker for the future.
Wonderful. Yeah, that's good to hear, and it's really important. So Steve, let's touch a little bit on Arizona. And I know everyone, as Mark mentioned, is looking for more relief, and hopefully that's coming soon.
Yeah, I thank you, Lisa, and thank you, everyone. Thank you, Andy, and honored to be part of this. And thank you to our friends in Mexico. And I apologize for my monolingual presentation today. I'll simply say that in Arizona, because as you heard, we're statewide. And so our largest city is where we're headquartered in Phoenix. But I'll speak to the state in general. And what happened with us is very similar to what Mark and Patricia explained with respect to San Diego and San Antonio. Our community came together in similar ways. in terms of the corporate sector and the philanthropic sector, and just donors and average people wanting to help. And typically in a crisis, you would expect it, but it was more than we'd ever seen on any crisis, and faster. And raising tens of millions of dollars to provide relief. And we also, when this started, we were also coming into the office every day and managing from a place. And right at the time, we had to prepare to respond to the needs of the community. We were shutting our office down, just as the others have. And we haven't been back since. And so we've been doing all of this work remotely. And so one of the lessons we learned, and one of the upsides, I guess, of COVID is we learned how to be nimble and adaptive and to be able to respond to our community wherever we were. And that led us to do some things that we wouldn't normally have done because so many different people were suffering, just like in everybody's communities on both sides of the border. Our small businesses were suffering, and our local municipalities had no way of getting all the money that at the time the federal government was sending to the states, and the states were sending to localities. They knew how to take money, they didn't know how to give money. And because we had grant-making platforms, we began distributing more and more dollars to small businesses, which we wouldn't normally do. And that became a very significant part of our work, because we believe that as go small businesses in a neighborhood or a community, so goes the ecosystem of the community. And so to keep those small businesses alive who serve those communities, and maybe in communities where large companies don't set up shop, those small businesses are vital to community health. Yes. And employment. And so we've done more in that area than we ever expected to do, and we would have never planned to do it. So for us, it's been learning to adapt every day to something new and different, and using what we know how to do things we don't normally do. So I think those were important things for us as a foundation. And I know in talking to my colleagues, we've all learned to do that and to be more responsive as philanthropists. And I know we always believed in responsive philanthropy, but we really had to live it every day and really adapt. You know, and the last thing I'll say, you know, in our state, our numbers on COVID are going up. It's worse than it was in March when we shut the office down. And today in Arizona, for example, over 4,000 new cases. And it was as low as 80 new cases, 100 new cases a day in the summer. And over the last 6 weeks, it's climbed and climbed and climbed, and we don't know when it's going to stop. And so where we thought we'd be funding recovery efforts, we're still doing relief. And we're really worried, as I know they are in San Antonio and San Diego, about an upcoming groundswell of evictions from people who are not going to be able to stay in their apartments or their homes. And this is occurring with many people at many economic levels, because people are losing their jobs, they haven't been reemployed, and they're not able to make it. And so we're fearful of what's coming. We know we can respond to it. We just, I think, all know it's going to require more resources than what we already have been dealing with.
Yeah, everybody is back, as you suggested, where we were, and maybe even worse off in some ways with this COVID crisis. So Laura, give us your perspective from the Annie E. Casey Foundation, where you are, what you've been engaged in with this pandemic.
Sure, I'm happy to do that. Thank you, Lisa. We're actually based in Baltimore, Maryland, but we are a national foundation, and we have a specific focus not only in our hometown of Baltimore, but in the South and Southwest. And so, but we are a national foundation. And so we are thinking about this effort and this work from a national perspective. And for the what comes up right away when I sort of think about the impacts of the pandemic is what the pandemic has exposed as far as the holes in our economy, as far as the holes in the social safety net and the programs that are designed to help families and young people make ends meet and to allow parents to be able to support their kids. This, as well as the significant digital divide, which I think Mark mentioned earlier. These are all things that are um, have bubbled up to the surface in a way that I don't think anybody would have predicted. And so for us as a national foundation, we have approached the funding response in a couple of different ways. A combination of immediate response, but also considering what the long-term efforts are. So we did commit some additional resources that we didn't have we hadn't planned at the beginning of the year to address basic and emergency needs and provide direct service in our hometowns, actually Baltimore and Atlanta, which is where our funding comes from, UPS, and they're based in Atlanta. So we have a specific focus in Atlanta, Georgia as well. And we've also considered, and from the beginning have focused on supporting and stabilizing grassroots organizations and other nonprofit organizations, because we know that they're critical, they're providing critical supports right now, but we want them to be around when the pandemic is done and when the recovery begins to happen. And a lot of those organizations, especially the smaller ones, are don't have a lot of reserves. And so we wanted to make sure that we were able to try to connect them to supports. The other thing that we focused on, and this was actually probably the biggest commitment of our funding, was to support policy advocacy to help fill those holes in the safety net, because we know that that foundation efforts, even if we were able to raise, more, which the amount of money that's been raised overall, and especially by community foundations, has been absolutely critical. But without the broader the broader infrastructure of what's available through government, we really can't meet the needs of everyone. So we've supported data and research and education to help inform national, state, and local policy discussions, really around health and safety and well-being for children and families, with a focus around communities of color, who we know are experiencing the inequities of the pandemic and the economic impacts more than others. The other thing which we did, and I know a lot of other foundations did, and I suspect we'll talk about this a little bit more later, is that we've made some changes in our funding strategy. So we shifted more of our grants to be general operating support grants. We extended the timelines for our existing grantees and allowed them to shift the scope of work. If they had planned to do work at the beginning of the year, we allowed them to shift that scope of work to meet the needs of the communities that were changing clearly. And a lot of them shifted their work from doing in-person things like providing job training for young people, or providing, even doing therapy sessions for young people who are involved in the child welfare system, doing those things in a virtual way. So I know that there's been incredible efforts happening across the country, and I think we're really excited to hear about the work of community foundations, because I do believe that they have absolutely served an incredible and important role in meeting really the basic needs of communities in this moment.
Yeah, it sounds like there's just been so much innovation and so much of an effort to really find ways to partner with organizations that you hadn't before, make sure those were organizations that now can move forward and be sustainable. I think, Patricia, did you want to add something?
I'm just so grateful for Laura just talking about so many of what you mentioned. I just was shaking my head uncontrollably. I'm appreciative of Annie Casey's focus intentionally on people of color, you know, one of the things that we noticed here in San Antonio, which I'm sure is similar to my colleagues, is that the things that those of us who follow these issues knew to be true before the pandemic were simply unveiled. You know, there was someone who had an incredible quote, and of course I can't ever remember it whenever I need it, but I'm going to tell you kind of how I remember it. But what the person said is, you know, we've made national news of all of the different cars in line for the food bank. And really what it showed was our weakness, you know, that we really are that close from the entire community really coming unfolded. And if you dig back even deeper and take the next curtain back, you see that those people who are hurting the most are people of color. And I think for a city like San Antonio, and I'm sure for many others, you know, we like to talk about the wonderful things about our community, but there are some ugly things that we've been required to look at. And in our response, we were really targeted at looking at, as the grants were coming in, having a really targeted effort to figure out down to the zip code, where were these families, who's going to be impacted by these grant dollars? Because we knew that while we're really proud of the 20 million that's come out very quickly, those still are limited funds. And so we have to figure out how to have that conversation. And I'm grateful that it wasn't a new one to the city, but it actually, as Mark said, it did have, if there's any silver lining, it really did push something that only a segmented group of people had been talking about. But not only, you know, because it's the right thing to do. Now we're having the conversation for those of us who had been in this work for a while. We know that it's an economic issue. It's not just as a benefit for people of color, that we have to do this to recover. So an equitable recovery means you've got to focus attention to people of color so that it benefits the entire community. And I think that that has been something that I feel most proud of, that conversation has been highlighted and really allowed to happen in many different circles.
Yeah, there was confluences of events going on beyond the pandemic as well, right? That also exposed that kind of racial injustice. Steve, I know you had a point you'd like to make on this as well.
Yeah, I just wanted to build on Patricia's great insight, because I think it's really, really important. And we thought we understood disproportionality, right? And in foundations that all of us, not just the community foundations, all of us are trying to address equity issues in our communities, and they exist in every one of our communities. We see it in education, we see it in healthcare, we see it in housing, we see it in finance, we see it everywhere. But we realized what we didn't see and didn't know, to Patricia's point. There were nonprofits serving communities of color and had been serving that had no way of accessing us and our grant dollars. And we kind of thought we knew everybody. We realized we didn't know everybody doing great work. And so through the response to COVID, we were able to learn about a broad group of great leaders in the community, unsung heroes, working every day without some of the access to capital that they should have been receiving for years. And so it's really opened our eyes to who's out there serving the community, and the disproportionality in grant making about who gets our grants and who doesn't, who gets access to our grants and who doesn't, and what are the systems that we actually put in place, despite our belief system, that actually wasn't providing full and complete equity within our community. And it was an eye-opener. It's changing the way we do our business. So I think it's been really, really important.
So I think that's such an interesting point. I'm sure the people on this Zoom call do as well. Mark, maybe you can give us an example of one of the organizations that you are now engaged with that you hadn't been before, and the kinds of things that you've learned from that.
Yeah, Lisa, as you probably know, San Diego County is a huge space. I think we're bigger than the state of Rhode Island, for instance. So we cover lots of territory from beaches to mountains to the desert. And so we just, so as a part of our effort, we made sure to really broadcast that we were taking all great ideas. And we also, of course, streamlined our application process to make it really easy. And we ended up having something like 680 applications seeking something like $60 million from the foundation. But we discovered some really fantastic organizations like the Nile Sisters, working with African women in San Diego. The Oceanside Kitchen Collaborative looked at how could we do food rescue and be able to get food out into various communities. Casa Familiar, right on the border at San Isidro, really being able to help them reach out to the people in their community. And so it's been an incredible opportunity. And probably like for Steve and Patricia, our staff did this work on top of their work they already had. So we had staff members who came in on weekends. They did 7-day-a-week work to be able to get these dollars out to our communities. And I can't think more highly of our team than some of the great work they did for us during this critical time.
Yeah, talk about essential workers. I think those community foundation workers, you're all essential workers. So I'm going to move to a topic that has been touched on here, but that I think is really an interesting development as well. Laura, you talked a little bit about these partnerships that have emerged. It sounds like, you know, foundations, governments, businesses, all working together now in a way that maybe they hadn't before. So can you tell us a little bit about that?
Sure. I think, I mean, I think there's this is an area where there's a lot. I hope that there's going to be an opportunity to really to stop and learn about. I mean, there's a few things that have been mentioned so far around how philanthropy has we've gotten to be pivoted to working much more quickly in a way that we never had before. And being more responsive to more organizations. I think one of the really interesting developments is around the opportunities to build on the tech sector to think like one of the things that we have done and we've supported for a long time is this idea around youth employment, giving young people access to apprenticeships and job training and things like that. And what we've seen in the pandemic is that young people, the 16 to 24-year-olds kind of age bracket, have been hit. They've had among the highest job loss as a result of the pandemic because they are in sectors that have been really significantly impacted by the pandemic, like the service industry, hospitality, those kinds of places where there's been significant job loss. And what we've been able to do is to work with employers to pivot some of those job opportunities and apprenticeship opportunities to areas that still have some growth, and that's mainly around the health sector. And also around training young people so that they can do contact tracing. And we're actually one of the more interesting grants that we did was as part of our COVID response was working with and helping to develop the Baltimore Health Corps, which was really working with young people to allow them to give them the training they needed in order to do the kind of contact tracing that we think can actually make a huge difference in stemming the growth of the pandemic. And I think, as I said earlier, I think that there's the role of government is continues to be critically important, will continue to be critically important in the future. There's going to be a lot of even more bumps in that road than what we were experiencing in a lot of ways because of the massive impact that the declines in tax revenue is going to have on government. There's some pretty scary numbers out there around what the expectations are around tax revenue and trouble that state budgets and local budgets are going to be experiencing over the next several years. So thinking about ways that we can, as in the philanthropic sector, help to number one, to help with do the advocacy work that's necessary to make sure that the people that we care about have access to what they need to meet their basic needs, but also to consider ways that we can build on these new more kind of what the evolving innovations that are happening as a result of the pandemic. And one thing I think that's really important to lift up is that there's definitely been, and I would be interested to hear what the other panelists can add to this within the local sphere, but the business sector has really stepped up in lots of ways during this time, both in kind of helping to meet basic needs for more people, as well as what's happened around kind of taking a stand on racial equity and actually putting some money behind it in some places. I think about the partnership that's happened, or the expanded partnership that's happened with Feeding America, which is a national organization that works with food pantries across the country. I think there's more than 1,000 food pantries that are in their network, and they have built some pretty amazing partnerships with national food producers, but also other types of corporations that have partnered with them and actually helped to try to stem some of the gaping holes that exist around the food pantries and meet the needs that we know are there. So I think there's a lot that we can build on, but I think it's going to be a tough road ahead, especially as it relates to the state and local budgets. And it's going to be a challenge. I don't think we can rely on philanthropy to fill that hole, but there is a lot that we can do to help.
Absolutely. So Patricia, you probably have a lot of nonprofits that you could share with us that are very interesting for us to learn about. So you can touch on that, and you could answer the question that I just asked about the new partnerships that have been developed between philanthropy, government, business. What's your perspective?
Oh, well, that's a tough one because now you're giving me a choice and I want to do
You can do them both if you want. And if you have questions to the participants in the room, please feel free to start putting those in the chat. We'll make sure to answer some of your questions. I already have one that I'll make sure to get to.
So really quickly, I'll address the nonprofit, then I want to talk a little bit about some really interesting public sector things that have happened. But on the nonprofit side, one that really just stuck out to me, just to show how innovative nonprofits are. And many times I make the comment about our nonprofits are very similar to the families that they serve. They can make a penny go a long way. One nonprofit is a national nonprofit, but has an office here, which is M Schools. Their whole mission is to make sure that they help immigrant families navigate the school system. And so already have very close relationships with families. What they did at the beginning of the pandemic, I thought was just incredible. It's such a simple but very important idea. The director knew that there was a digital divide issue. So it's not that easy to order groceries over the internet. That wasn't an option for families. That's if they had money. But what she applied for in the COVID response fund was to be able to use her own computer to then provide and get groceries to the families who she already had relationship with. And if you think about that, that's so simple, but she's probably one of the only people that she was trusting at the time, the families were trusting when everything was shutting down, and families who were already on the margins and who are afraid to go to government resources, even if those might have been available, really provided a haven. On top of that, as if that wouldn't have been as creative enough, she knew that small businesses were hurting. So not just delivering groceries, but she would reach out to a small business who was trying to stay afloat as well and get dinner delivered to that family in need. So that's one of my favorite, but there's a bunch that we could take some time to talk about. On the other side, though, about the public sector, one of the things that I found really interesting about the city is very quickly, we pay a lot of money in philanthropy for narrative change, right? How do we help those who are not connected to these issues understand the issues of poverty and racial equity? Well, really, the media was doing it all for us, right? Unveiling how difficult families were having it, not having a job the very next day when things began to shut down. So in my perspective, took advantage of bringing together leaders from all different sectors, from business, from philanthropy to higher education, to put on the ballot this November, Proposition B, which was a 1/8 sales tax, to be able to do some workforce development training. Because all those different perspectives were at the table, we took best practices of a nonprofit. We know that it's not just about the training. You've got to provide all the wraparound services. You've got to think about childcare. And so what was on the ballot was an opportunity to get people trained up into high demand, high wage jobs with influence and perspectives from all those different sectors. And luckily, I truly believe, because the narrative and the curtain had been pulled back and we saw how much the community was at need in some of those jobs that may never return because things will be different, it passed. And so next year we'll be able to have a whole different level of money available. I think it's about 38 million. And that's really insignificant to me. The money is is not the significant part, is that very quickly they put together a ballot initiative that was meeting the time. And I think that's what we're going to need, because as Laura said, even if we want to get to recovery, we're not there yet. We're really still helping people just meet their daily needs. But that's just a couple of examples.
Yeah, that's great. I did also love that idea that Laura brought out about training young people to be contact tracers. I mean, what a great idea, and something that's so essential right now. Would be great to get that implemented. Steve, let's talk a little bit about, you mentioned that ACF has been engaged in supporting small businesses and doing a lot of things that we hadn't done before, and that you're getting funds from municipalities or other forms of government to help distribute because they're not really sure how to do that. Can you touch a little bit on that work?
Sure, and I think it also speaks to what another thing that Patricia had said. You have to meet the time, and which I interpret as meaning that you have to think really differently about your role and what is the first order need of your community, even though there are all kinds of rigid structures about what you're allowed to do as a foundation or a community foundation, and what the rules tell you to do and the law tells you to do. And, if you just blindly adhere to those things, you're not going to meet the time. And, the common thing for us was we fund only nonprofits. We don't fund for-profit companies. But every kind of funding we do has to have a public benefit. And so when our local municipalities realized that the federal government did send out money and they sent it through the state to give to municipalities, when they realized they didn't have a mechanism to get thousands of grants from $500 to $200,000 a wide range. And they went to the one place they thought could do it and had the capacity to do it. And they came to us and we said, well, the initial reaction was, well, we don't do this because we don't do small business grant making. We do nonprofits. And we had to check ourselves and meet the time. The time said, how does a community survive? What is the public benefit of a small corner market to a community where there's no supermarket for miles and miles, and this corner market is the only market that provides you the fresh foods and vegetables and meats that your family needs to eat, right? And they're about to go under. And you have to say, well, being a for-profit corner market makes no real difference. What has to happen is that market needs to stay in business, right? And so we had to really meet the time and question our assumptions about what was public benefit. And I think we all had to be willing to accept the risk of doing that if some official somewhere asked us why are you funding for profits? You're a foundation, you're only supposed to do nonprofits. And we said, we think the time requires us to do it. And the need in the community requires us. So that was the first obstacle, was our own barriers to thinking differently about public benefit and community benefit. And really rallying around the idea that this really is helping the community. And you don't have to be a nonprofit to help the community, although that is our core business and that's who we will always support. And when this is over, we'll go back to just supporting them. But it's given us entree into many critical people leading in communities through their businesses. And it's enabled us to build partnerships with local governments that we hadn't worked for before. And we can really measure, because we are all struggling with how do we measure our impact. We can much better measure our impact when we hear the stories of these business owners and what a $5,000 or $10,000 or $25,000 grant, nobody ever gives them money. Nonprofits are used to getting grants. That's what we do. For-profits had no idea, one, how to apply for them, and then the very idea that there were no strings attached to the dollars. And so we had to learn how to give it to them. They had to learn how to get it and receive it. And we had to learn a new level of, I'll say, community patience to be able to educate thousands of small businesses around how to get a grant, no matter how we simplified the process. So there were a great many things we learned, but we learned more importantly that whatever our community needs, we need to be prepared to do, no matter who thinks we shouldn't.
Yeah, and I think that's a really interesting point, and we do have a few questions in the chat that relate to this topic. So, one of them is a pretty simple question about whether we grant only in our communities or whether we grant globally or along the border only or into Mexico. So that was one of the questions. And the other one that is, I think, interesting and important is the COVID funding that's going to businesses, has some of that emphasis detracted from our giving to those other organizations, the nonprofit, the arts and cultural institutions that we typically give to? So Mark, do you want to touch on that?
Yeah, thanks so much, Lisa. So we, of course, like every other community, when we had this incredible shutdown, our arts and cultural organizations suffered so much because they all depend on earned revenue, and their donors also turn to support human need. So we quickly launched with several donors and also working with the city of San Diego, an arts and cultural challenge fund, in which we helped seed that fund, but really asked others to come out and support it. One of the other things that we did as soon as we went all in on our community response fund is we went to our fund holders in particular and said to them, we would love for you to support the community response fund. Here's what we're going to do and how we're going to get these dollars out. But we said to them, if you want to do grant making on your own through your fund, please do general operating support. Do not tie it to any project. Don't tie it to a gala. Just give them money. And the outpour, it was tens of millions of dollars that went out in such a capacity from our fund holders. And we had several fund holders who just wanted to empty their DAF. We told them keep a little bit in to keep it live, but for their donor advised funds, they were just so generous in doing so. But to Steve and to Patricia, we also created great bonds with our county government, where we had probably never played much previously. So we helped create a small business and nonprofit loan program with $5 million. We had a $25 million child care grant program to help childcare providers who are just suffering by not having any kids in their properties. And we got out $25 million working with the YMCA of San Diego and another great group, Child Development Associates. And we had these dollars out in probably a month or two. And did the, I've learned how we have to be a kind of a UN at times, because I think we had 8 different languages where our website could be translated. We worked with community groups and community health groups to help them get people subscribed to this. So it's been all in for us. We do also have a regular and ongoing grants program, particularly for the environment here in San Diego. And so that continued to churn along. But at this point, we said, it's human need and that suffering that we had to help so much. And we all lived by Maya Angelou's great quote, fear and hope cannot reside in the same place at the same time. Invite hope to stay. And we said constantly, help us help others find hope in their lives.
Yeah, I love that. It's so true. We have to keep hope alive. Yes, Steve.
I wanted to add, because I think somebody had asked an important question. So the small business relief funds were totally different than our COVID funds for nonprofits. And as both Mark and Patricia have said, and I think some of the work that Casey, as Laura's talked about at Casey. But what was happening at first, because small businesses weren't used to it, these were separate funds, earmarked specifically for small business. And it was, we had lots of money and we were getting it out, but we needed to get more of it out. And we said to the local governments, you need to think about nonprofits as small businesses, because they are most. And we were able then to redirect not all, but some of small business relief to nonprofits by convincing the municipalities to broaden their definition. And so we could get to arts organizations who were really suffering and other nonprofits that were functioning small businesses. So it actually proved to be an additive support to nonprofits. We would, just out of our principles and our ethics and our mission, would never have used nonprofit dollars meant for nonprofits were most of our assets for profits. We could only do it with this new flow of money that was earmarked for that. And I want to make sure people knew that.
Yeah, good. That's an important point, and I'm sure that helps Mark with his question. So let's talk a little bit about the emerging needs your foundation is seeing in the nonprofit sector. We talked a little bit about, some of the smaller ones needing support to make sure that they stay around. What else are you seeing from the nonprofit sector? Laura, do you want to talk a little bit about that?
Yeah, I mean, I think several of the pieces have been mentioned so far. I think at least from our perspective, I think there was a lot of fear at the beginning of the pandemic that there was going to be extremely dramatic impacts on the bottom lines of nonprofits, that many may not be able to continue, that they might shut down. Certainly that's likely to have happened, but there's I think for the most part that we haven't seen it happen so far, and that's for a variety of reasons. A big piece of that was the Paycheck Protection Program that the federal government put into place, that many nonprofits that through advocacy that happened at the national level were made available, that they were eligible to apply to. And there was a lot of support that was given from a variety of different places to help the nonprofits figure out how to do it, because it, like most processes that the federal government comes up with, it's not that simple. And to also, and one of the things that we supported was some support directly to local community financial institutions, who many of them stepped in to assist the nonprofits to apply for the forgivable loans. And of course, the massive infusion of funds that came from this sector, from funders, the billions of dollars that came from funders. I already talked a little bit about, as far as like upcoming needs that are going to be we see on the horizon. I'm going to say it again because I think it's can't be overestimated, which is the impact of declines in tax revenue on state and local budgets. Is going to be a huge challenge for nonprofits. Many of them, well, it's going to be a huge challenge for all of us who rely on the schools funding and on the fire department and the folks who fix our water systems and all kinds of things. But it's going to impact the nonprofit sector, because many of them rely on state and local funding streams and federal funding streams to support their work. So that's, I think, extremely important. I think that Steve mentioned the fear that I think we're all feeling around what's going to happen when the eviction protection runs out for people, and the jobs. We don't know what's going to happen with the employment situation over the next 6 months. And so that's a real fear for lots of folks across the sector, and especially those who are focused on housing issues. But we don't, it's been a while since people have been able to access the relief funds that came through the CARES Act, and on the federal side, it's been several months now. We haven't, the additional relief bills are still stalled in Congress. Hopefully there'll be some movement on that front in the early part of the year, but without that, there could be some pretty huge implications for families and for all of us. And the nonprofit sector there'll be even more strains on the food banks and bigger and more cars waiting in line to get access to those services. So that's certainly, I think we see that as a really huge concern, and something that we're all focused on.
So yeah, I agree with that 100%. It's going to be interesting to see what lies ahead in the coming months. And as we mentioned, we hope we get more relief funds soon. Patricia, if you could just answer that question that we had from one of our participants around whether you're only doing funding on the border or whether you go further into interior Mexico for projects, and then talk to us a little bit about the other issue that we had discussed.
Sure. No, unfortunately, our area is limited to very adjacent. I mean, direct funding for grants is generally adjacent to San Antonio. It's about an 8-county region. But most of our policy investments and our other kind of collaboration does than have some state and binational impact, but direct grants, unfortunately not. But to shift back to the question around, what are some of the emerging needs? I agree so much with what Laura said, but I think the other thing that's not coming from surveys, I'm sure like everyone has been doing surveys weekly to try to monitor, especially initially, how things were changing for the nonprofits. But one of the things that I think isn't coming out is really the mental health, not just of the entire country, right? This is an incredible pandemic, and it's impacting all of us in so many different ways. But our team has got a special attention on those who are called to give by design. They are in the jobs of nonprofits very intentionally because they feel a larger calling to help others. And I think that very quickly can be drained and burnt out. And so some of the things that we've heard just in side conversations is, how are we going to get our refill? And we know that this is for the long haul. And what does that actually look like? And how do you, as a foundation or in philanthropy in general, provide space for that? And so we've been trying to think creatively about what that might look like. One of the most interesting things that's associated that is that we had funded a couple of different leadership development opportunities. And initially, when COVID started, we thought that the cohorts were going to close down and that they were going to revisit because, so much about leadership development opportunities is being connected with people in the same room and doing the small breakout groups. But as we talked to the participants about whether or not they wanted to continue, what we had happen was, no, please don't stop it. Even though it's on Zoom and I'm zoomed out, this is the only time when I get to connect and not continuously give, but be refilled. And so I think that as we think about the future and recovery, it's our responsibility to think about what role we can play in really supporting the mental health of those who are on the front lines of serving the families in need.
So thank you for that, Patricia. It's an important reminder about people on the front lines serving in so many different capacities right now. We have a number of questions in our chat, so I'm going to start with one. A thank you for everyone for contributing to this important conversation. I think this one looks like it may be for Mark. It says, for us as a public media entity, this has meant less funding available for reporting. We see a need to expand coverage of South Bay, San Diego, and the border region. As a nonprofit, we need funds to bring in a reporter. We've already had to lay off and decrease many staff hours, but reporting is critical. Are there any recommendations for reporting on border issues? Mark?
Sure. Yeah. One of the nice things is we ask nonprofits and organizations, you can send us your information all the time. And if there's something that bumps up against one of our granting programs, or if we have fund holders who we know have areas of interest, we work really closely with them. So for that person, I would say, yes, please. I think the address is Community Impact at San Diego Foundation, and you can send us that information. But one of the things that worked really well for us, Lisa, is we formed an incredible partnership with our largest television station and news station in San Diego, CBS 8 KFMB. And they were incredible partners for us, providing us lots of time, getting stories out, to talk, to do largely what Patricia mentioned about changing the narrative and helping people understand that there's hurt all over the place and it's right around the corner from you, no matter where you live. So we really ramped up our media efforts in ways we never have before, and the partnerships were incredible for us. So we have some well-known media sources like KPBS and iNewsSource and The Voice of San Diego, but we also turn to our African-American newspaper, The Voice and Viewpoint. and really started to reach out to all of the community newspapers that really reach ethnic and racial populations in San Diego during this time, to let them know about the grant making that we were doing.
That's wonderful. Yeah, that's so important because they are directly connected to those communities. There's another question about, but again, thank you. And would it be among your priorities to support social restoration and restorative projects to heal relationships in communities? Who would like to tackle that one? Steve.
I can start, but I'm sure everybody wants to get reply to that. I do want to say the last question, we do fund journalism. We've funded a 3-year project to put an investigative journalism team in the Arizona Republic. We did it a couple of years ago to focus on the child welfare system in Arizona, which was broken, and we wanted to get it before the public. And now we just started on funding the Arizona Republic for affordable housing and housing insecurity. And they just did an incredible piece on the evictions we've been talking about. We think funding journalism, I'm not pushing Mark to fund you, the last questioner, he'll decide. But we think, especially these days, keeping the First Amendment alive, keeping journalism alive has a great public benefit, and it can force public leaders to face issues they don't want to face. And we're also funding the Arizona Center for Investigative Journalism that produces stories. So I think it's a really important part of the funding ecosystem, and I think it's really valuable. I think this second question on the restoration of communities, and particularly the communities that have been most hard hit by this, both those most hard hit by the pandemic, by the health crisis, were most hard hit by the economic crisis too. So as often with disproportionality, as I said earlier, it plays over and over in different sectors of the community, but the community itself feels it along all those dimensions. So we have been, and I think Laura mentioned it, I don't think anybody thought relief funding would last this long, because a lot of us fund disasters and there's a relief period, which is the immediate relief to the community. And then there's recovery, which is longer term and involves things like, creative financing, like Mark was mentioning, and other types of grant making, and the longer rebuilding of what was hurt. But there's something more in this about the injustice that COVID and many other issues in the United States emphasized and came to the front, although they've always been there, and if you wanted to look for it, you could find it. It was easy to see, but the rest of our country started to pay attention. But moving people to the restorative process is much more difficult. People respond to what they see and the pain of people, and they might give immediately. And then, and this is not blaming people, but people move on. But the weaknesses and the disparities and the inequity that cause this disproportionality to begin with require the hard work to fix them.
Right.
And meeting the time is not letting the moment get away where we just move on after this. And we don't restore communities, that needed restoration and support for that well before COVID hit. But there is a new opportunity now that more people see it and know it. They need to stay heads down with us all to work on it. And that's going to require different kinds of grant making and different engagement of people in communities, and allowing the voices of those communities to drive the actions of all of us in philanthropy in terms of determining what they believe they need to be restored. In Arizona, it's not only a large and for many years disenfranchised immigrant community, large numbers of people who are living in Arizona and have not been given their full rights. They've always need the support and the restoration of our undocumented workers, of Black communities, of Native American communities that suffered COVID far worse in Arizona. And so it's hard work to fix that. But if we don't stay on it after COVID, you know, we have done a serious wrong to what we say our beliefs are. So I think whoever raised that is right, needs to continue to be raised. We're re-examining, how do we make grants? Who gets access to us? Who doesn't? If we have a fund that somebody left to us for diabetes, well, why are we giving it in the city of Phoenix when the rates of diabetes are so great in the Navajo Nation or the Tohono O'odham Nation, which runs right a parallel along the US-Mexico border? And so we have to rethink all those things, and we're in the process of doing it. It's going to be a lot of work, but it is going to be a big part of the recovery, is the restoration.
Yeah, and I will just take a moment to talk a little bit about that Undocumented Workers Relief Fund that we started at ACF, which was another way that we engaged with communities that we hadn't necessarily before directly. And we got so many grassroots Latino organizations and people engaged and funding us. And it's been well over 1.5 million that we've raised for that fund particularly, right, Steve?
Yep.
So we're close to the end of our time, and unless anybody has anything that they want to add right now, I'm going to go to another question. There's a couple more questions. Patricia.
I would. I just could. I mean, Steve, I thought what you said was just so right on in so many ways. And if there was one role, you know, whether it's, you know, program dollars and changing our grant, all of that matters. But I think it's using our influence. We are in a very unique place. You know, I often say we're in el medio, right? You're in between people who want to give from the goodness of their heart and really difficult community needs. But those worlds don't connect oftentimes, other than those dollars. And so looking forward, I think not just for the Area Foundation, but in general for philanthropy, how do we keep that conversation going so that healing can begin? There's a recognition that a lot of these dollars are raised or got because there are inequities, and those are hard conversations to happen. But I do think figuring out a way to host those times. I know that even with some of our board members who have more recently gone through racial equity training, had some real eye-opening moments. It had been the first time in their life that they had seen how structural racism is really impacting another person, not because they had their eyes closed or didn't want to, it just hadn't been their experience. And so I just feel like we are in a really privileged place to be able to facilitate those very delicate conversations for the restoration and just reform and really relationship building of our community if we do it well and keep focused attention on it.
Yeah, I think that's a great point, Patricia. And you're talking about people who are here working and serving so many of our communities in so many important ways. But as you suggested earlier, you know, one step away from dislocation, and that's what we saw with this pandemic. I'm going to go to a couple of questions, and then we're pretty much done. We're at 7:20, so went fast. Let's see, Michael Camacho, he's asking, I run a small nonprofit, and one of the things I'd like to enable my organization to do is receive more complex forms of donations, such as stock, real estate, bequests, etc. Can community foundations help us with that? Mark, you're nodding.
Yeah, so of course, your community foundations are here for you to be able to do that. So in San Diego, as I'm sure in San Antonio and in Arizona, we have a charitable real estate foundation that can take in these assets. It's a supporting organization, so we can take on that risk where most other organizations can't. And we've got the talent to be able to turn those assets into cash and get those to organizations. We're actually starting to take a look at how, and because so many nonprofits have been so decimated, how could we become the planned giving office for the nonprofits in San Diego County? So we're taking a look at a number of different ways we could do that, but please turn to your community foundation. They're more than able to be able to help you.
Thank
So
you, Mark.
we do a
Steve?
lot with and manage a lot of funds for nonprofits. And so if a nonprofit, another way to do it, in addition to what Mark was saying, is if you create a fund, and we have certain types of funds for nonprofits, and we certainly would help and train with our planned giving people on our complex gift team. If you are the beneficiary of a complex gift, you know, that's a special capacity you have to build in your organization. But if you have a fund with us where maybe I'll call it your endowment or your savings account, and you're able to secure such a complex gift, we'll make that transaction for you, and that will be your asset in your fund. And we'll make sure, as Mark said, you can convert it to cash, and all the money will go into your fund that you set up. So you definitely, wherever you are, every community foundation ought to be able to help you do that, because it's a great source of potential gifts.
Wonderful. So we do have one last question, and it really does relate back to what we've been discussing. Laura, you've touched on it quite a bit tonight about the relationship between the responsibility of government versus the responsibility of philanthropy and how those intersect. So, you know, it's just a question around, what do you see our influence as foundations might be in this space moving forward? And then I'm going to ask each of you to just provide some closing remarks, because we are at time. Thank you. Laura?
Sure. Well, I mean, I think I have to put in a pitch, and I don't know how many other funders are on the call. But the need is so great right now, and there's certainly enough relief in this that's needed right now to have that be the entire focus. But to really have to fund the advocacy that needs to happen around policy at the state and local and federal level, so that we come out of this this time, the pandemic, the economic issues, with a more equitable recovery for everyone. It's a challenge to juggle those things, especially in community foundations, I'm sure, because the need is right at your door. But I want to put in a pitch for that. And the other thing, because I feel like I've been bringing a little bit more gloom and doom maybe than some of the other panelists in this conversation, that as far as my closing, because I feel like I'm generally an optimistic person, so I want to leave this, is that I think there's been so many bright spots in the way that people have chosen to give of their time, of their money, and to really consider their communities as important in their lives, and that they want to contribute in a more kind of mutualistic way. I mean, there are many different ways that this recovery could go. There's, the economic inequality has only gotten worse over this time. There are lots of folks who are making lots of money in the stock market right now, and lots of folks who are unemployed. So there are forces pulling us in many different directions. So I just want to encourage us all to lean into those positive mutualistic forces and the bright spots that we've seen, and to try to build on those, so that's what we take forward in the time, hopefully soon, when we'll be looking at a post-pandemic world.
Thank you, Laura. You're right. We have to stay in that Maya Angelou space of hope. Mark, did you want to answer that question and move into your closing remarks?
Well, I'll just go to closing, Lisa, but for me today, it's a very special day because for 7 years I lived in Gettysburg, Pennsylvania, where on every November 19th, we pause to remember President Lincoln's shortest and arguably most profound speech, his address that memorialized the deadliest battle of the Civil War. And while 77 years have passed since he delivered those remarks, I can't help but to reflect on the poignancy of his words, particularly today. And I think while the circumstances are so vastly different, the president's call for action remains relevant in this moment. My favorite sentence from Lincoln's Gettysburg Address is, "It is to us the living, rather, to be dedicated here to the unfinished work which they who fought here have thus far so nobly advanced." Together, I believe, we can all strive to finish this work that allows everyone in our respective regions to thrive, prosper, and probably most importantly, feel like they belong.
So beautiful. Thank you, Mark, for that reminder. Patricia, you're on mute. There we go.
Hoping I didn't have to go after the poetry.
Yes.
Steve, I took this one for you.
After
So
the
you told me
Gettysburg
something later.
Address.
Just close it down. Close it down, Mark. Drop the mic.
But truthfully, I stand in awe of our colleagues, not only on the panel, but those who are on the front lines. They've really just given so much in this time. And I know that there's so much work ahead. To end, I think on a hopeful note, I truly am so hopeful that the silver lining of all of this is that it's requiring us to really think how to build back better, not to make it a political statement, but truly to make it a more equitable recovery. And I think that's what's bringing me hope, that collaboration and innovation will move forward, but so that we truly are a country that lives up to its promise.
Beautiful. Steve, thank you, Patricia.
Well, since Mark brought up presidents, we have a new president with a very different view of the relationship that this country will have with our friends on the other side of the border, and a very different sense of humanity for what we share as two nations and neighbors and historical friends. So I'm really hopeful that this new vision that our new president will bring quickly replaces the vision of the old president, the former president, the past president. And I think that gives me a great deal of hope. And that's not a political statement. That's based on what we've seen and what they have told us. So I'm hopeful. And what I learned from this, that it was never really about the money as much as it was to as we refer back to Maya Angelou, the hope and the support. What we learned, for those of us that give money away for a living, we get thanked all the time, and people really do genuinely, sincerely thank us. But the thank yous since March have been a different kind of thank you. They've been extremely emotional, and the psychological, psycho-emotional response to the community saying to whether you are a nonprofit struggling, facing an existential crisis, or a small business, the very act of your community sending you a check, no matter how large or small, meant to them that their community was behind them, that their community was supporting them, that their community wanted them to succeed and the people they served. And I think the power of giving can have negative effects, but it also can have positive effects. And I think it was the great sense of support the community felt by seeing all of us and all of us on this panel reach out and say to them, we support you, we want you to make it, we're gonna do everything we possibly can do. And here, take this for now, hopefully this will help, and come back to us later. And I think that act has transformed You know, I know it's transformed my staff because everybody on our staff, and I'm sure like everybody else's who've been part of this, have felt it and seen. We share these letters and notes, and that's been the power of this whole thing. And so I leave with those two hopes of the future.
That's beautiful. So I know everyone on this call has been just inspired and really, really grateful for each of you taking time today to speak with us. And so on behalf of the U.S.-Mexico Border Philanthropy Partnership, thank you, Mark, Steve, Patricia, Laura, for your participation and for your foundation's efforts to support these COVID-19 relief funds in our communities. Just remember that you can visit borderpartnership.org and get involved with the organization and give there if you'd like to give, or reach out if you have questions. Thank you to Andy and Elisa for putting this panel together, and good night, everyone. Thank you.
Night.
Lisa.
Bye-bye.
Thank you, everybody.
Thank you.
Lisa, thanks. Good to see you, Steve.
Likewise, Mark, take care.
You too. Thanks, Andy.
Thank you, Mark.
Thank you, Andy.
Lisa. Thank you, Steve. Thank you, Patricia. Thank you, Lisa.
Andy, a ti muchas gracias.
Salió bien.